Hi, my name is Jessica Martin. I'm going to be doing a brief assessment of a newborn. Let me fix this. One of the very first assessments you're going to do in a newborn assessment is you're going to do an APGAR scoring. Basically, the newborn receives a score of 0 to 2, each 5 areas for a possible score of 10. And then that's going to be at 1 and again at 5 minutes. So the score is from 7 to 10, or 7 to 10 indicates a vigorous newborn that is adapting well to the environment. And the 5 categories are going to be heart rate, respiratory effort, muscle tone, reflex irritability, and color. You're going to also want to test the reflexes. That's going to tell you about the neurological status. And brooding is basically you're going to stroke the cheek of the newborn, and the head is going to turn towards the stimulus and open the mouth. Sucking, you're going to place your gloved finger in the infant's mouth, and the baby will suck vigorously. The Moro reflex is when the baby is startled. You're going to sit the baby up and support the upper body and head, and then you're going to kind of drop them a little bit, still with them in your hands, and the arms and legs are going to extend symmetrically. Tonic neck, you're going to turn the head of the infant to one side, and the arm and leg extend on the side that is placed, or the face is pointing. And then the opposite arm and leg flexes, and then you're going to repeat on both sides. Gallant's reflex, you're going to place a newborn in ventral suspension. You're going to stroke the skin on one side of the back and the trunk. And hips should swing toward the side of the stimulus. The Palmar grasp, you're going to place your finger in the newborn's palm, and the infant's going to firmly grasp your finger. Stepping, you're going to hold the infant upright. You allow the soles to touch the surface. The legs are going to flex and extend in a walking pattern. And then lastly, Babinski, you're going to stroke one side of the infant's foot upward from the heel and across the ball. The infant's going to respond by hyperextending the toes. You're going to want to do a general survey on the infant. Basically, most invasive techniques you're going to do last. If the baby's sleeping, you're going to count respirations first and listen to the heart, lungs, and abdomen. For vital signs, you're going to count respirations for a full minute. 30 to 60 is normal. You're going to listen to the apical pulse for a full 1 minute, and that's usually 110 to 160. The axillary temperature is right under the axillary, and that should be 97.7 and 98.6. And then blood pressure is not usually done, but blood pressure should be taken in all 4 of the extremities, and the normal systolic for newborns is 50 to 70. You're going to assess your patient for pain. You can kind of tell if the newborn's in pain because they're going to be uncomfortable and excessively irritable, so they should not show those signs. You're going to want to measure your infant. You're going to want to weigh it. You're going to place the newborn on a scale with a protective covering, and then just stay close to the patient to prevent falls. You're going to grab your tape measure, and you're going to measure length. So starting from the crown, and then you extend the leg and measure to the heel. You're also going to be measuring head circumference, and just wrap it around, measure that, and then you're going to measure chest circumference. And then once you get the measurements, you're going to plot them on a standardized growth chart. For nutrition, you're going to ask the mother about bowel movements and urination. The newborn should have wet diapers 4 to 6 times a day, and regular bowel movements that are soft and not watery. And if the mother is bottle feeding, you're going to ask the parent how many ounces per feeding and how many feedings per day. To assess the mental status, just observe the patient while they're sleeping and just behavior throughout the exam. You're also going to want to note the mom and newborn relationship and see if the mom's engaged or not with her newborn. You're going to assess the skin, hair, and nails. So a healthy infant skin is soft and snaps back to original shape after gently pinching. It's also going to be free of rashes, lesions, bruising, and edema. You're going to assess for Mongolian spots, usually on the back, macular stains, and spider nevus. The hair is going to be soft and shiny. You're going to inspect the nails. They're going to be soft, appropriate for length, and nail beds are going to be pink. You don't want to see blue. When assessing the head and neck, you're going to assess the head size, the shape. You're going to check for symmetry. You're going to palpate the anterior and the posterior fontanelles. The anterior should be flat, not sunken or bulging. Bulging occurs with crying sometimes. And then you're going to assess the range of motion. You're going to turn the patient's head side to side, head lag. The motion should be good for that. And when you're holding the infant up, you're going to see head lag in the newborn, which is normal. You're also going to inspect the trachea, which is midline. So you're going to feel for that. No swelling or masses are palpable. So you're going to look at the eyes. You're going to assess for symmetry, movement. You'll have a pen light, so you'll look, see the sclera is clear and white, pupils are round, and make sure they're equal and reactive to light. The ears, you're going to assess ear placement, make sure that they're symmetrical, no drainage coming from them, and assess the color. For the nose, you're going to inspect the nose, make sure it's symmetrical. The nares, make sure they're patent. Newborns are usually in nasal breathers, so that's important to keep it patent. The uvula, you'll see in the patient's mouth. When it's crying, it should be definitely visualized. The lips, see if they're symmetrical, fully formed. You're going to have your pen light, look at the mucous membranes in the eyes, and the mouth, the nose, make sure it's moist and pink. The thorax and the lungs. Thorax is symmetrical. Chest expansion is equal bilaterally. No signs of distress or uses of accessory muscles. You would auscultate all lobes from the front, the back, and then under the arms on both sides. Breast sounds should be equal bilaterally and louder than in adults. You're assessing oxygenation. The nail bed should be pink, not blue. And then you're going to assess capillary refill time on both extremities, lower and upper, and make sure it's less than 3 seconds. For the heart, you're going to auscultate the heart. You're going to listen to the heart rhythm. You should hear the S1 and S2, and no irregular or extra beats should be heard. You're going to look at the breasts. You're going to observe the nipples, make sure they're midline. The areolas are full, and nipple bud is well formed. For the abdomen, you're going to inspect the abdomen. You're going to look at the umbilicus, make sure it's clean, no discharge coming from it. You're going to auscultate vowel sounds, which in all 4 quadrants, you're going to assess for, the sounds, and that should be heard in all 4 of them. So you do that, all 4 quadrants. You're going to percuss the abdomen, dullness, like in the adult, is heard over liver in the right upper quadrant, and then tympany is heard normal over an air-filled stomach and bowel. And then you're also palpating the abdomen, make sure that it's soft without rigidity, no tenderness or masses felt. The musculoskeletal system, you're going to be observing throughout the whole assessment. You're going to observe the strength, movement of the infant. You're going to note the shape, appearance of the hands, the palms, fingers, and toes. And then lastly, you're going to inspect the genitalia. If it's a female, you're going to inspect the labia, make sure it's clean, dry, and free of odor in the female. In the male, you're going to make sure it's clean, and the placement, you're going to note the placement of the urethral meatus, and then you're going to evaluate the scrotum for size, color, and symmetry. Then testes descended bilaterally.